Hospital ICU beds are filling up and medical teams are stretched. They're once again on the front lines of a pandemic, this time taking on the Delta variant. BNC's Jamise Price is live in New Orleans, where one hospital is getting relief while other hospitals across the country are reaching out for federal help. Jamise?
Naira, the medical team here at Children's Hospital is getting the help they so desperately need. A federal medical disaster team is here on the ground to help them care for some of the youngest victims of this COVID fight. But there are still hospitals across this country that are in need of help as ICUs are near or at capacity level. COVID patients are packing hospital emergency rooms and ICUs. And the victims of this latest surge are babies, toddlers, and teens.
I can't take care of kids. That's too much.
Nationwide, 73% of ICU beds are in use. 21% of those beds are being used for COVID patients.
Our ICU beds are full. We're taking care of 5, 6 patients at one time. That's not an easy task.
In Arkansas, just over 8 ICU beds are available. A federal team is helping the state figure out how to make more room. In Texas, ICUs are near or at capacity. Now hospitals are preparing tents to handle the surge of patients. In Louisiana, nearly half of the state's ICU beds are in use, including those at the state's largest children's hospital, where a 3-month-old and a 23-month-old are fighting COVID.
Here at Children's Hospital in New Orleans, we've seen an increased surge of COVID patients in pediatric patients over the last 3 weeks. So our nurses, our respiratory therapists, our non-clinical team members in the pharmacy, in the lab have been really overworked for months due to other viral surges.
Now they're getting help from the federal government. A 14-member disaster medical assistance team is on the ground getting prepped to start taking care of patients.
This is not their first rodeo, and they're coming here to step into the gap and work hard and just give that extra set of hands, take patient assignments, really to maximize the care that we're giving to the children and their families.
The team includes 4 nurses, 3 paramedics, a respiratory therapist, and pharmacists. Paul DeSerbo is leading the team.
We are going to go through with hospital staff one-on-one and pair up nurses to nurses, paramedics to paramedics, and make sure that they have a solid lay of the land and understanding of what's going on. And we are completely onboarded to help alleviate some of the stress on the staff here.
And the help is needed. More children are in the hospital fighting COVID than at any other point in this pandemic.
These are individuals who have dedicated their entire lives and careers to helping out some of our most vulnerable population.
Hospital leaders say this will provide some relief, but it's only temporary. This team will be in place for the next 11 days. In New Orleans, I'm Jamise Price for BNC.